Good afternoon, everyone. Welcome to the City of Alameda Mayor's Town Hall. I'm Sarah Henry, the city's Public Information Officer. Joining us today is Eileen Eng from the Alameda County Healthcare Services Agency to talk about the shelter-in-place order with Alameda County and the county's COVID-19 vaccination plan. Please note that all participants have been muted. To submit a question for the mayor or Ms. Eng, please use the chat feature. All of our town halls are recorded and are available on the city's website and our YouTube channel. I'd now like to turn today's town hall over to Mayor Marilyn Ezzy Ashcraft.
Thank you, Sarah, and good afternoon, everyone. Thank you so much for joining us. And we are so honored today to have Eileen Eng as our special guest, and she is a member, she's policy director with the Alameda County Healthcare Services Agency, and she's going to be giving us some really important information for employers, for those in the workplace, questions you might have about this latest shelter stay-at-home order that we are under as Alameda County in cooperation with the state of California. So I want to commend our residents and businesses. You have risen to the occasion. You have helped keep Alameda's COVID-19 numbers the fourth lowest in the county. I check regularly. But we are, if you follow the news, you know that we are in the midst of a really difficult, actually frightening time, because COVID-19 is increasing rapidly in counties around us, and even in our own county, we've seen some alarming increases. So I always feel that when residents and businesses are well informed, they will make good, sound decisions based on science, based on data. So that's why I'm so honored that Ms. Eng has been able to carve some time out of her very busy schedule to talk with us and answer your questions. So it is my pleasure to introduce and welcome Eileen Eng from Alameda County Healthcare Services Agency. Welcome, Ms. Eng, and we look forward to hearing from you.
Great. Thank you, Mayor Ashcraft, for having me here today to provide you all the Alameda County COVID-19 update. I will share my screen because I have a brief slide deck. Are you able to see the slide on your screens? Great. So in this presentation, I'll briefly cover some of our county data, cases and hospitalizations, what the California regional stay-at-home order encompasses, and then also our local vaccination plan and framework. So in this slide, you'll see here, we have a COVID-19 dashboard that you all can visit. And actually, the numbers are that I took from a day or two ago. So today's numbers, the cases and deaths have increased. So in Alameda County, it's actually now 34,881 cases. Deaths is now at 533. And then on this data webpage, you can also access information on case and case rates by zip code, testing data, percentage positive tests by zip code, hospitalization data, including bed capacity and an ICU bed capacity, and then skilled nursing facility data. On top of this slide is the web link to that data dashboard. And I wanted to pull out data specific to the city of Alameda. So as of today, the cases in city of Alameda is at 779, and that is approximately 935.7 cases per 100,000 persons. This is a graph of the county's COVID-19 daily case rate. So this is the worst that we've seen the COVID pandemic in Alameda County across the region and the state. There is a lot of COVID circulating in our county today, and the number of newly reported cases is at a record high and increasing daily as shown in this graph here. All activities in which people mix with other households are much more risky now than they were several weeks ago. This is a graph of case rate by ethnicity. The blue colored bars is Alameda County and the yellow is the city of Alameda. And as you can see here, Hispanic, Latino, and African American and Black are facing higher rates of infection and death in our county. This graph here is of our COVID-19 patients that are currently hospitalized in Alameda County. And in this graph, you'll see the rapid increase of number of COVID-19 patients hospitalized and the increase of patients in ICU. And in the Bay Area region, that includes the ICU bed availability, and that we are at now 17.8% as the Bay Area region. The next couple of slides, I will go over the state's regional stay-at-home order. So the stay-at-home order, the state broke it out by regions, and Alameda County, we are in the Bay Area region, along with Contra Costa County, Marin, Monterey, Napa, San Francisco, San Mateo, Santa Clara, Santa Cruz, Solano, and Sonoma. So Alameda County, we adopted the state's regional stay-at-home order. What it does is it temporarily, it's a temporary additional restrictions that are in place from December 7th to January 4th. This includes Contra Costa County, Marin, San Francisco, Santa Clara counties, and the city of Berkeley. So in Alameda County and some of our neighboring counties, we acted earlier because of the rapid escalating surge in cases and hospitalizations. And we needed to take action to slow it down and to prevent our hospitals from being overwhelmed and to save more lives. And as mentioned, and you've seen in the previous data slides, metrics are worsening too quickly for us to wait for the state threshold. So the goal of the state's regional stay-at-home order is to stop the rising transmission rate, to protect our healthcare system, and then to prevent severe disease and loss of life. And the lifting of the regional stay-at-home order will be guided by our data trends. But however, the region may still be triggered by the state order when we hit the 15% ICU bed availability. And if the order is lifted, the county will resume the blueprint tier restrictions. Some of you may recall, before we adopted the regional stay-at-home order, our county was at the purple most restrictive tier in the state's blueprint tier. So Alameda County is following the state's order, and the state has allowed a few activities that permit some low-risk mixing. But the overall message is that people need to stay at home. Some of the key restrictions of the state's regional stay-at-home order includes all private gatherings are prohibited. All non-essential travel is also prohibited. Restaurants can open for delivery and takeout only. Personal care services, that includes hair, barber, nail salons, are closed. Hotels can only be open for essential needs or workers only. Retail, it must be limited to 20% capacity with entrance metering. And schools that have already opened before this regional stay-at-home order is not affected by this order. And then the state order that stops non-essential activities between the times of 10 p.m. and 5 a.m. is still in effect. And then there are local and state websites and supporting materials that are being updated. And in Alameda County, we have a list of open and closed businesses in the link provided below. We recognize that these closures and restrictions have a profound impact on our businesses. And the state stay-at-home order is not about any one sector, but it's about having folks stay at home to limit the spread of COVID. This slide here just has a general summary of the regional stay-at-home order. Of when it would be triggered is when the region itself, so our Bay Area region, reaching to less than 15% ICU bed availability. And then once it's triggered, it has to remain in effect for at least 3 weeks. And then here are some resources that I want to share with you. If you want to see more about the regional stay-at-home order, that's the link to the state website. The 2 links where it says regional stay-at-home order, the first one is that takes you straight to the state's exact language of the order. And then the second one is that the state issued a supplemental stay-at-home order to clarify the capacity at grocery stores. So they had to issue a second supplemental order. And then there is a link to the state's critical infrastructure list, because during the regional stay-at-home order, the state does allow critical infrastructure to continue to operate. The state also provides business support. They expanded upon the California Main Street Small Business Tax Credit. There is a link to that as well. The application is open from December 1st to January 15th. And then there are criteria that must be met. So businesses that employ 100 or fewer employees as of December 31st. And then they have suffered a 50% decrease or more in income tax gross receipts when they compare the second quarter 2020 to the second quarter of 2019. And then for other California business support programs, there's a link provided as well. So we have numerous teams that respond to COVID inquiries from businesses, members of the public. We have a general COVID inquiries line. There's an email address there and a phone number. We also have a team called COVID Recovery that provides local guidance and technical assistance for businesses on how they can safely reopen. There's also a web page in our Alameda County COVID website that provides resources, tools, and information. And there's an email address where you can email COVID Recovery with any questions you might have, or if businesses would like for them to review their site-specific protection plan, we can do that as well and then provide feedback and guidance. Then there's a COVID workplace team for employers who are reporting positive cases among employees. It's a state requirement that employers are to report within 48 hours. And the COVID workplace team can provide further guidance on next steps of what employers are to do if an employee has tested positive for COVID. And then briefly, I have 2 slides about our vaccine update in Alameda County. So this is our vaccine prioritization framework. California is adopting and refining the federal recommendations for a phased approach. And the state is expected to share further guidance on phase 1 this week. And right now, I want to mention we are in phase 1 out of the 4 phases that is on the slide here. And then movement through these phases will depend on the vaccine supply and demand. Local health departments, so this is our Alameda County Healthcare Services Agency and our public health department. We actually may only have minimal discretion over the prioritization within each of these phases. So the estimated timeline, I know everyone wants to know what the timeline is for the rollout of each phase. So the estimated timeline for this is that phase 1A will occur through December, and then phase 1B will be in January. Phase 2 will be spring. Phase 3 would be the summertime, and it's a possibility that this is actually a year-long timeline for our vaccine dissemination. So for our local plan and how our county is preparing for the vaccine, is that the Healthcare Services Agency has a multidisciplinary COVID vaccination team that has 3 focus areas. One is the Community Advisory Group that will focus on equity and have a stakeholder process to engage and inform residents and community partners, and then seek input on vaccine prioritization, build trust within the community, develop messaging, and managing any misinformation. The second focus area is our healthcare delivery team, and working with and coordinating with our clinical providers that include hospitals, community clinics, private practice. And then also have a collaborative process to support countywide prioritization and equity strategies. The third focus area is immunization logistics. So that is our liaison to a state immunization team, monitoring our cold chain and their capacity, planning community-based points of dispensation during mass vaccination, and then ongoing data and progress monitoring. I also want to note here that the Alameda County Healthcare Services Agency is planning a cities meeting in addition to these 3 focus areas. And that is the end of my presentation, and happy to take any questions.
Thank you. Thank you so much, Ms. Eng. That was fascinating to me. And I will just say that Ms. Eng is humble and didn't point out to you, so I will, that she is actually the team lead for Healthcare Services Agency's COVID recovery in the workplace team. So that, and I'm told that she works closely with members of our city's economic development department and community development on to help our local businesses. And this is for providing safe reopening plans for businesses. And then she is the co-lead for the COVID, let's see, the COVID in the workplace team. So when an employer discovers that an employee or employees have tested positive, there's a certain protocol that needs to be put into place right away to limit the spread of COVID. So thank you for all the work you do with our city. And so I wanted to just ask a couple of questions. Well, and by the way, I think Sarah has, did you let people know? You did at the beginning, didn't you, Sarah, if they have questions? Okay.
Yep, just put them in the chat.
Put them in your in the chat box and we'll get to them. But I want to start out, let's see, where do I want to start? So do we know the vaccine that Alameda County will be getting maybe as soon as next week? Is it the Pfizer vaccine?
Yes, it is the Pfizer vaccine, and then we're going to get Moderna after.
Okay, that's great to just have them keep coming. So both of those vaccines require 2 doses, as I understand. How will Healthcare Services Agency, or whoever's administering the vaccine, how will they make sure that people know to come back within, I think it's 21 days for one and 28 days for the other?
So with the phase 1 piece, which is our health system, I think the state already allocated the second dose as well. So that will be given directly to our hospital system to distribute and also vaccinate their employees. But with the whole second dose piece for the general population, I think that's why we have those focus area groups, is to help inform us on what the messaging we need and what should that look like based off of all the different diverse and unique communities that we have, and developing that message to ensure that they will come back for that second dose.
And that actually, you raised a good point, because I guess the first doses in the first phase and the second doses are for medical providers and for people who live in these assisted living facilities. So they're kind of a captive audience, and certainly a well-informed audience. And then I was listening to NPR this morning, and I heard a doctor, I think he's a pediatrician and a vaccination specialist from Philadelphia, but who was one of the panel advising the FDA in this hearing that they had yesterday, who's been looking at all the test results. And what he said was that when we can get 2/3 of the population vaccinated, we can start returning to life closer to normal. So what I would love to know from you is, how can cities help you achieve that goal? Because I know the rest of the city administration stand ready, willing, and able to do whatever it takes.
Thank you so much for that question. It definitely takes partnership, coordination, and I know with cities, you've developed that trust. And so we rely trusted messengers in helping to get that word out. Social media, word of mouth, partnerships with other trusted organizations, using those established relationships. I know that will take some time, which is why we are starting now. And any suggestions and ideas that you all have, we are most certainly open to it. And that's likely probably one of those main questions that we will also ask you all in the city's meetings that we will be holding.
Yes, I look forward to those meetings, and we are privileged to also have our very capable public information officer, Sarah Henry, who I know, as we speak, is making her mental list of all the different outreach we can do, and to our different community partners and organizations. So we'll start getting that information together, so Alameda, the city of Alameda, can be a really high turnout for the vaccines when they come our way. What else I wanted to ask you was, so I was looking at the statistics that you were citing, and I mean, just from last night, because I know you were gracious enough to send your PowerPoint over last night, just since those figures that you were relying on were released today, we've seen an increase in the city and in the county. And what about our ICU bed capacity? Now we have 17.8%, but just before the governor's order went into place, do you recall what Alameda County's ICU capacity was?
So the 17.8 is the region.
The region,
Okay,
okay, all the counties.
20 something as a region when we did the stay at home.
Yeah, I remember it was over 25%, Mayor.
Wow.
So it's a huge difference.
And that was when, let's see, December 7th, just this past Monday, is when the order went into place. Yeah, because one of the things I know we have, I can see a number of business, folks in our business community who have tuned in. And one of the questions I get was, why didn't the county just wait until we reached the 15% or fell below the 15% threshold that the state put forward? And what would you say to that question?
So just seeing how we've issued previous stay-at-home orders or shelter-in-place orders, it actually takes weeks for us to see an impact where cases might stabilize. So we knew that this surge is escalating so quickly that we had to put that in place before we hit the 15. Because if we adopted it when we hit 15 by next week or week after that, if we didn't slow it down or implement these strategies, our hospital and ICU would be completely overwhelmed. So this is a strategy to try to slow it down as much as possible.
Yeah, no, and I'm completely in agreement with that. And I am alarmed when I see statistics. I think I saw this morning that Santa Clara County's ICU capacity is around 8% now. And it just does go to show how fast the cases can increase. And we're probably, I'm guessing, starting to see some impacts from the Thanksgiving holiday. Is that what
Yes.
is driving some of this increase?
Yes, and even before Thanksgiving, we were seeing an increase, but now we're seeing cases come in from Thanksgiving.
So what advice would you give to people? I know you've touched on it in the presentation, but we do have our winter holidays coming up. Hanukkah has started, we're approaching Christmas. In Alameda, we have a street that is nicknamed Christmas Tree Lane because the neighbors put up beautiful lights and decorations and people come from far and wide to see them. But what advice would you have for people celebrating this winter holiday season?
The advice is to stay at home, don't mix households, physically distance, face covering, and then wash your hands frequently. And if you have any COVID-19 symptoms or have tested positive, isolate. If you've come into close contact with someone who has tested positive, then you should be quarantining. And that's the same advice that we've had consistently given.
And I have heard that more people are getting tested. How is the lab capacity? Like, what are you finding the turnaround time for test results to be currently?
I think with our community sites, there might be a minor delay in turning over test results, but I don't think any significant negative impacts at this time.
Okay, is it around 2 to 3 days, if you know?
I think depending on where you're getting tested, it is like 2 to 3 days.
Okay, but we're hoping that people aren't getting tested because then they want to go and travel for the holidays, correct?
Correct. However, if you have traveled, you should get tested when you come back into the Bay Area.
Good point. Thank you. And can you talk about, there's a new app that's come out from the state, I believe, or it's going to be rolled out soon. It's called, because it's on my phone now. What is it called? Sarah, help me out.
It's
California Notify.
CA Notify, yes.
CA Notify, right. Can you talk a little about that, Ms. Eng?
Yes. So if you have an iPhone and you've updated your operating system, you can turn it on through your settings. I think with Android, you have to download an app, but it identifies, just generally doesn't provide very detailed information about a specific person who might have tested positive, but it does give you some general information of what that looks like.
Yeah, I think from what I've read, it's an exposure notification. So it lets you know, it's like cell phones talking to each other, but encrypted and no personal data revealed. But if you were in contact with someone who has reported testing positive and you were in contact for, is it 15 minutes?
Cumulative 15 minutes.
Cumulative 15 minutes. So anyway, that's something that I would encourage. It's one of those things where the more people who participate, the more data points we have and the more effective the system can be. Sarah, I think you're getting some questions from the audience. So why don't we switch to those? This information is so helpful and so fascinating. I could talk to you all afternoon, but this is a wonderful opportunity for members of the public to ask their questions as well. So what have we got?
Yeah, it's great to have you here, Eileen. Okay, so first question that's come in is asking if there will be some sort of registration site for people to register for the vaccine and be prioritized based on their age or essential worker designation or another priority need. How will folks be able to tell you that they are a high priority for the vaccine?
Thank you for that idea. I don't think that all those details are worked out yet, so I could share that with our multidisciplinary team. Appreciate that feedback about resources and tools that we might need in support of vaccination dissemination.
Great. And then when it's ready, that's certainly something that the city can help promote through our channels as well, if there's some sort of place where people can self-identify. Perfect. The next question that's coming is asking, when do you anticipate that, and this goes back to maybe your slide, but when do you anticipate that teachers and students will be vaccinated so the virus is not a reason not to be open? While the school district is doing their best to make virtual learning work, this person says that it's not really ideal and that they see students of all ages losing ground on their learning.
Yeah, just like double checking this. I think they're they're in phase 2. K-12 teachers and school staff and childcare workers are in phase 2.
And was that the spring?
Yes, that's the spring. Estimated timeline, that's the spring. And when saying spring, like probably March, April timeframe.
Okay. The next question is asking, can city officials do anything more than give the stay-at-home advice to impact potential super spreader events like Christmas Tree Lane? I think that's more for the mayor. Oh, here you go. Sorry. You should be able to unmute.
I was about to hold up my cue card that says, unmute me. Please." We're still working out all the bugs in this. So what can the city do to prevent super spreader events like Christmas Tree Lane? So I have to say, residents were amazing over Halloween. I called myself the Grinch who stole Halloween. And you turned out your lights and you didn't give out trick-or-treat candy. But that was wonderful. So we just didn't make Halloween a super spreader event because Alameda's got some streets that are really popular for Halloween. And so for Christmas Tree Lane, what we're trying to do, and I've been in contact with a number of residents on Christmas Tree Lane, and they have been great. I'm told that they've kind of toned down the decorations, not put anything out on their lawns or yards that would encourage people to stop and mill about. But it's kind of that balance between people need to brighten their spirits, and it's kind of nice to see decorations. We would ask, and this chagrins me to say this, but we would suggest that the safest way to view Christmas Tree Lane is actually from a car, preferably an electric vehicle, so that you're not spewing greenhouse gas emissions. Right now, it's a balance, and on balance, I just want everyone to be safe through this holiday season. And so we're not going to be out patrolling walkers, pedestrians who come to see the lights. We would ask you to do the things you know you're supposed to do, which is only go with your immediate family group. Everyone's wearing masks. Stay 6 feet away from other people who don't live in your household with you, and just keep moving. It is good to get out. And I encourage everybody to get out in the fresh air, take walks, get your exercise. Keeps your spirits up too, but just don't congregate. Even though you're outside, if you're not wearing a mask and you're too close, you can still be spreading this very dangerous virus. But if at all possible, just take a drive through. But if you go there and you see there's lots of people, then come back another time.
Definitely. Thank you, Mayor. Eileen, could you go back and share your screen to the vaccine, that chart that had the 4 phases, just for folks that might have missed it. And in particular, somebody's asking if there's a list of what groups are in phase 1 and phase 2. So if we can pull that slide up, that'd be great. And then if you could talk about that.
And I bet we could share that.
Oh, absolutely.
Time, right?
Yes.
Okay.
Do you all see that?
Yes.
Great. So with phase 1A, we have the high-risk health workers. So those are the hospital staff workers who frequently come in contact with COVID-19 patients, and then first responders as well. Then phase 1B is people of all ages with comorbid and underlying conditions that put them at significantly higher risk. So these would be like the older adults living in congregate or overcrowded settings. The reason why they're in 1B is most often when outbreaks happen in long-term care facilities, they end up in the hospital and ICU. So 1A is to protect our healthcare system and then to prevent it from being overwhelmed. So that's the phase 1. Phase 2, we have the teachers, critical workers, people of all ages with comorbid and underlying conditions, people in homeless shelters, people in prisons, jails, detention centers, and then all older adults that aren't included in phase 1. 3 are the young adults, children, workers in industries and occupations important to functioning of society. And then phase 4 covers everyone who, for whatever reason it might be, did not get access to the vaccine in phase 1, 2, or 3.
And Eileen, could you also go over the time frames for each of the different phases?
Yes. So the estimated time frame for phase 1A is through December when we get the Pfizer vaccine, I think expected next week. Phase 1B, the estimated time in that would be January.
And Eileen, sorry to interrupt, is that going to be the Moderna vaccine, or is phase 1 all Pfizer?
I think phase 1 is all Pfizer, but even then we don't have enough Pfizer vaccine to cover the 1A.
Okay.
So I think that you're trying to figure out Moderna and Pfizer.
Yeah.
Than just that part of the phase.
Okay. And so then phase 2's date would be?
That would be spring. Maybe it would be March, April. So all this is just estimated because
Sure.
it really depends on our supply and demand, and then our cold chain. And then do we have staff doing the vaccinations?
And tell us what you mean by cold chain.
Cold chain is these vaccines need storage at very specific temperatures.
Right.
And so we need to ensure that locations that are housing or storing these vaccines have that refrigeration capacity.
Right.
And there's also very detailed instructions on how many times you can open a tray, and then when that vaccine need to be disseminated, meaning in the time it's open to the time it gets into someone's arm.
And I was, I'll just segue briefly, this past Monday, I think it was, I went over to our Mastic Senior Center where there was a flu vaccine clinic going on. And I had been told by Dr. Jocelyn Garrick ahead of time, don't be surprised, Mayor, if you see many more personnel than are needed to vaccinate the folks who come through, because this is a trial run for when we get the COVID vaccine. And I have to say, it was really impressive, and just going around to the different, and there were many people there, and some volunteers from the Medical Reserve Corps were there as well. But they've definitely scoped it out. But they were telling me that I guess the county is getting some of these cold storage freezers are coming this month. I think I heard.
Yes, we will also have some as well.
Oh, because that was, we're two different agencies. But anyway, we're so excited to be having these venues going on in our city. Okay, so then that takes us to phase 3.
That would be the summertime.
Summertime, okay. Right. And then phase 4
would be right after.
Okay. Okay. Thank you. I think that probably answers the question, Sarah, that our listener posed.
Yes, it does. Thank you for that. And then I have one more question, and this person says the following. They've read the statement by the San Mateo County Health Officer, and his statements make sense to this person. And they say that while they're certainly concerned about limiting the spread, the broad restrictions Alameda County is imposing earlier than the state requires have a much broader impact, including significant negative impacts on our children's mental health. In Alameda County, what is being done to assess the negative mental and physical health impact of the broad restrictions, and what would prompt the county to consider more targeted interventions?
Thank you for raising that question. So we have our Alameda County Behavioral Health Department, which is one of the 4 departments within our Healthcare Services Agency. And also they are working on this as well, along with our health officer. And it's always a front of mind when we make these type of decisions. They're difficult, but we do try to look for a balance. But often we have to also focus on the public health safety as well. But mental health is also extremely critical, especially during this time, and recognizing that a lot of folks are suffering. We have asked our behavioral health services to provide resources to our residents to address this.
So how would a resident access the services?
So they can reach out directly to our Alameda County Behavioral Health Department, or they can email ncov@acgov.org, and we can connect you to the resources. Also, we have the Alameda County COVID webpage that has mental health resources available there as well.
There are excellent resources available, and if I know Sarah, she's probably adding that to the chat box as we speak. You know, it is difficult. I'm aware of the San Mateo County Health Officer's decision to not go along with the other counties in the region. I don't know what San Mateo County's ICU bed capacity is right now, but I was reading the paper this morning, and down in Huntington Beach in Orange County, where the residents and the city government have consistently resisted the governor's orders and on mask wearing and compliance, their ICU beds are 100% full now. And so this is what I want to get everybody back to reopening to, and I want our young people, our kids back in school. But I want us to be healthy. So I'm really hopeful, and I'm optimistic for my city, for Alameda, because residents, like I said, they really have complied. When I'm out and about, or even my house is on kind of a busy street, I'll look out and there'll be joggers and bike riders and people walking, and they're all wearing masks, and that is great, and they're distancing. And so that's what we need to keep doing for a couple more weeks, is, you know, to January 4th to make this push to get the numbers down, to flatten that curve. And then, and I've said this many times, I really believe that time and science are on our side. And now we do see this vaccine coming as soon as next week for our medical workers working with these most critically ill COVID-19 patients. So we need your patience, but I don't mean to minimize any of the suffering and the economic stress and mental health impacts that this has had. It's been a very challenging time. And then I wondered if I could, I think she's still on the call. Amanda Gerke is works with economic development, and she's amazing. And Amanda, I'm wondering if you could just talk to our listeners a little bit. Hi, thank you, bless you, because I didn't give her any warning. But so Amanda is somebody who works with our businesses, and she is such a wealth of information, including about grant opportunities and financial assistance that might be available. So Amanda, would you be so kind as to just give folks kind of an overview of what's currently available, how they could get in contact if they're having some challenges with their business? Thank you, thank you, thank you.
Yeah, I'm absolutely happy to. Right now, there's a new loan opportunity from the state of California called the California Rebuilding Fund, and I can put the link for that in the chat. That's one of the main new loan opportunities. Unfortunately, the Alameda Strong grant program is not taking new applications at this time. But folks who want to be put on the mailing list when we reopen that fund, I can also put my email in the chat box, so they are welcome to reach out to me, and I'll make sure they get that information. One thing we are also recommending to folks is we have two excellent organizations in the East Bay that can provide business counseling to our businesses, and that's East Bay SCORE and Alameda SBDC. And what they do is they provide personalized counselors to work with businesses kind of one-on-one and provide technical assistance, so they can both help businesses to figure out what they need to do to kind of overcome this current situation, but then they also do provide technical assistance when it comes to applying for grants, so they can help businesses to do that. And of course, we are all keeping a keen eye on Washington to see and crossing our fingers for federal aid, hopefully in the next couple of weeks.
Yes.
As soon as we get that information, we will be sharing it with all of our businesses and doing whatever we can to help connect folks to those resources.
Yeah, I thank you so much, Amanda. Is she good or what? She's more than good. I was listening to NPR this morning and talking about the haggling that's going on in Congress, and I cannot imagine how in good conscience the legislators could go home without passing a relief bill before the end of the year. And I guess Speaker Pelosi has even said that she would entertain the possibility of working between the Christmas holiday and New Year's, but for crying out loud, we needed this aid yesterday. So hopefully that doesn't take too much longer, because you're right, we need that badly. So businesses take advantage of that opportunity. And then just really quickly, because I think we've come to almost to the end of our hour, and I think the end of our questions, but there are things that there was a little confusion about. Well, I can tell you that because I was on a call with our public health officer for the county, Dr. Nicholas Moss, this week. Dr. Moss confirmed that Santa Claus has been deemed an essential worker, and that he practices all the appropriate protocols, does contactless delivery, and always wears a mask, and so he will be allowed to work, and so children should not worry. However, what we do not allow this year are any photos with Santa Claus. So there will not be a Santa Claus at the shopping centers. There will not be a Santa Claus on Christmas Tree Lane. But Santa and the elves are busy working away at the North Pole, socially, physically distanced, and all those good things, but no photos with Santa this year. And Ms. Eng, what other last bits of advice would you leave with Alameda residents and businesses?
So we're here to support you all if you ever have any questions. And I know that it can be very confusing with the state rules and maybe even local restrictions and what that might mean. Feel free to email the NCOVE email address, or COVID Recovery, or COVID Workplace, and we can provide you resources or direct you to the most appropriate resource.
Thank you so much. Sarah, anything else we should let people know?
No, I would just to add that we're such a partner with the county, folks. Because they know us, if they want to ask us their questions, we can also ask them of the county. They're super responsive. Every time I've emailed anybody, I'm getting a quick response the same day, sometimes even the same hour. So definitely don't hesitate to ask questions, because people are here to support.
Yeah, and I will just echo that. I like to say there are a number of silver linings to this cloud of the COVID-19 pandemic that I've discovered. And one of them is your agency, the Alameda County Healthcare Services Agency. So impressive, such dedicated professionals, and just so accessible. So thank you, and please carry our thanks back to your colleagues. It's always a pleasure interacting with you, and I'm on every call that Dr. Moss does and hang on his every word. So as I always say on those calls, thank you so much for your work keeping our residents and our businesses and our community safe and as healthy as possible during these challenging times. So Eileen Eng, we can't thank you enough for joining us today and helping inform our residents and businesses. To everyone out there, take care, stay safe, wear your mask. I've got mine with the reindeer on on it, because why not have fun while you're masking up? Anyway, I look forward to seeing you out and about from a distance. Wave from behind your mask. Take care and stay safe. And we'll see you next week. Thank you again for joining us. Thanks so much, Ms. Eng.
Bye, everyone. Thank you.
Bye. Thank you, Sarah. Thank you so much, Amanda.